Hey, Dr. Shakib here from Irvine Spinal Wellness Center, your Irvine chiropractor. Let's talk about building your arms and building a nice strong core, which starts from here to here by doing a 6-month-old baby pose. So stay tuned. So one of the things that happens in babies is developing neural tract, the connection between the brain and body parts, and also developing strength in muscles. The one pose that we do, and of course we work our way up to that pose, is the 6-month baby pose. In this pose, the primary doer of the job is working the triceps. This pose allows the hands through wrist, elbows, and shoulder joint to communicate with your scapular or your shoulder blades, essential for everyone who work behind the computer. Why? Because we get to slouch and we get to use a lot of our upper trap in this area for a lot of things that is not an upper trap's task. So if something needs to get done, everyone, body parts, chips in to get the job done. But as a result of that, there's an overuse of certain muscles, exhaustion and tightness of certain muscles, and weakness of other ones. So more than likely, when you start doing this exercise, you're going to feel a lot of tension in your elbows. And what I'm going to do is I'm going to go from late 3-month to 6-month, so you get to see what I'm talking about. If you feel a lot of tension and pain in your triceps or in your elbows, go to the end, meaning the 6-month pose, and make sure that all the elements are in place. In this exercise, we want to make sure that the front of the chest, up at the shoulder area, is as wide as the back. In other words, if these 2 points here, if I'm slouched, the 2 points are closer, and if I stick my chest out, the 2 points are farther apart from each other. We want to make sure that the sides, if I place a point here and here, they are pushed back and maintained there. The next thing is I want to make sure my upper trap does not come into the picture. The moment it's involved, I'm doing the exercise incorrectly, which means you need to stop. So we're going to start with the 3-month late phase and go to the 6 months. You stay on your forehead. Your hands are placed under your shoulders. Bring your neck up, keeping your shoulder blades in place. Elbows are pointing down. In this pose, I'm going to make sure I'm not using my glutes to keep me up. This is not a glute exercise. This is pure triceps. The weight is right above my knee. My legs are flat on the ground. The top of my feet are flat on the ground. I am having a neutral spine, so I'm not dropping my back and holding myself this way. I'm engaging my barrel, which is another video I've done. My fingers are nicely wide. Their fingers are apart. I'm putting pressure on all of my fingers, not on one side more than the other, and I'm pushing the ground away. If I have that vision of pushing the ground away, I'm lifting everything up because I'm pushing into the ground. I'm not loading myself above my wrist, but I'm holding it there and I'm simply activating my triceps to push into the ground. pushing into the ground is the same as doing this versus just bending your elbows. Push the ground away. Neck is on the same line. Neck and head are on the same line as my spine. I'm opening my chest up. My upper back is flat. My lower back is not curved, or is not arched. It's in a neutral position. I'm engaging my barrel and I'm holding this up. As I come down, I try to make sure between my shoulder blades, I don't drop my chest towards the ground. This is triceps doing the main work, communicating with the shoulder stabilizers throughout the up and the down pose. This is a 6-month pose of developmental kinesiology, highly important, great exercise. Thanks for watching. If you like what you saw, subscribe to my YouTube channel and make sure you share it with other people. If you have any questions or comments there, just put it down at the bottom of the video and we check the messages regularly. Also, I have a podcast. The link is in the description box here, but the podcast is called Life and Health Matters with Dr. Shakib. Check it out. I have great information. It is a biased opinion, of course, but I hope you enjoy it. Thanks for watching.